nurse pulmonary student nurse from Tomas Laudio Colleges, and today I will be performing a heart and vascular assessment. So before we proceed, we should perform first a hand washing to avoid transmission of bacteria. Second is gather all the equipments. Make sure that the equipments are in good condition. Third is identify the patients. And before we proceed, assume that my patient is around 20 plus years old. So now we will proceed to our assessment. So good morning, ma'am. I am Alros, your nurse for this morning. So can I have your name?
Amaya.
Okay, Ma'am Amaya. So for today, I'm going to check your heart and your vascular. So if you have any concerns, feel free to raise it. Is it okay with you, ma'am?
Yes.
Thank you, ma'am. So before we proceed, ma'am, I'm gonna ask you some few questions regarding the heart. So, ma'am, may nararanasan po ba kayong pananakit sa dibdib?
Wala.
Heart surgery po?
Wala.
Family history po?
Wala.
Okay. So, since wala po tayong nararamdaman, po-proceed na po tayo sa ating first procedure. So, the first that is, I instruct first the client to lay down in supine position and also turn her neck to the right to inspect the carotid artery. So, in this kind of position, the vein is visible. So, the vein shouldn't be visible like the other person because it may indicate a problem on the heart. But we all know na pag petang tao ay nakikita talaga yung vein nito. Pero normal lang yon. So, at this position, wala naman tayong nakikitang parang bumabakat na vein sa kanyang lieg. So, all in all, it's actually normal. So, for the second one, we will palpate the patient carotid pulse on the left and also on the right. So, the pulse should be the same and also smooth. So, now we will palpate the carotid pulse of the patient. So, the first one is the left. Okay, so I feel the pulse. So on the right. So, as I palpate the left and the right carotid pulse of the patient, the pulse is actually normal and also smooth. And mararamdaman mo talaga yung pulse ng kanyang carotid. So for the third one, we will auscultate the patient carotid pulse. We are finding for a squeezing sound which may indicate a heart problem. So first is that we will check the stethoscope. Okay, so we will now auscultate the carotid pulse of the patient. So the first one is on the left. So ang naririnig ko ay normal na pulse lang. Same also sa side na to, normal na pulse lang yung naririnig ko. So for the result, wala naman akong narinig na squeezing sound and normal lang ang kanyang beat ng kanyang pulse. Moving on, for the fourth one, we will inspect the patient's pericardium, which is part of the chest. And we are looking for the abnormalities, the movement, no, kung ano yung mali as the patient inhale and exhale. So as we observe, normal ang movement ng kanyang paghinga. And as we can see, a normal respiratory lang yung nakikita natin. And for the next one, we will palpate the point of maximal impulse, which is located at the mid-clavicular line. at the fifth intercostal space, where you can feel the pulse. You will now palpate and feel the pulse. Okay, so the pulse is smooth and normal. We will auscultate now the patient's heart. So the first one is at the aortic area, which is at the second intercostal space. So, narinig ko na ang kanyang heartbeat. So, we are listening for a murmur sound or a S1 and S2 or lobdub sound. Move on to pulmonic area, which is located at the left second intercostal space. Then to the lower left sternal border, which is at the fourth intercostal space. Here. And the last one is the mitral, located at the fifth intercostal medial to mid-clavicular line. So, narinig ko na ang kanyang pulse. So, I heard the S1 and S2 sound or the lobdub. And I don't hear any hurt or murmur sounds. So, the pulse is normal. So, we're gonna repeat it. So, we will auscultate again using the bell of the stethoscope or the low pitch sound. And now we will proceed to the vascular area. So, the first thing that we will do is looking up for the upper extremities of the body. We were looking for the skin color. And also the skin temperature using the back of our hand. So the temperature is warm, which is normal. And for the lesions or bumps, I see no bumps or lesions. And we will check for the nails, including the capillary refill. So the nail color of the patient is pink. And also we will checking for the radial pulse. So the pulse beat normal. Same also with this side. And proceed to the brachial artery, which is located at the upper arm. So I feel the pulse and it's normal. Proceed to the lower extremities. So the first thing that we will do is check for the skin color. And check for any lesions or bumps. And next, check for the temperature using the back of our hand. Proceed to the fingertips. So we will check for the nail color and also the capillary artery. Move on to the posterior tibial artery or the pulse, which is located here. So mahina lang siya, no? Moving on to the pedal. Okay, so medyo malakas yung pulse dito. Okay. So as we check the upper and lower extremities, the results are normal. So we are now done with our assessment.